All right, number 10. Now, we know we've had the fracture. After the fracture, we had to have quite the operation, right? So we can see we have this big scar, and that's going to be the next one, number 11. We're going to do some work on that scar, okay?
Okay.
So, we did the fracture before. When he had the operation, we had this big bandage here, and we just lasered over it. So the laser is best on skin, but we can laser over a bandage, right? So for open wounds and for burns, we want to use infrared, and I like to do it for about 60 seconds over the area where the wound would be, right? Or the burn. That's the big thing. So we're going to come here, and again, we're going to paint the area, and then we're going to follow it up with about 150 seconds with red. So 60 seconds of infrared, 150 seconds of red. We got multiple different frequencies in here. Now, after a wound, I might want to come back with a step 5, which would be doing more of a lymphatic protocol or an inflammation protocol, something of that nature, which you're going to see a little bit further down the line. So step 1, belly button. Step 2, nerve root. Step 3, area of involvement, activation. And then 5th step would be doing a system that would assist in what you're doing. Okay? So we're going from infrared to red, large area here. We're going to come over the open wound. At this point, it's already sealed up. You can see the scar here, but I'm giving you a nice demonstration of how we would do it. So we just had a cut in the family the other day on the thumb. Same thing. We're going to come in there. Now, hopefully you'll get a chance to see some of our things that we did with burns. There is nothing better that stops the pain with burn patients, really bad burn patients, than the laser. You can see people that are on morphine drips that are hitting that button all the time trying to get out of pain. And when you come in and you do a laser treatment for about 4 to 6 minutes, you can see them just calm down and relax. We actually have pictures and videos of lasering areas, and you can see the scar tissue build, the breakdown, and actually see the circulation, or it turns pink. When you burn yourself, your skin becomes hard as a rock, like wood, right? Really, really dense because of the scar tissue. So the laser is increasing the healing time, helping the skin to heal faster. Now, skin cells replace themselves about every 28 to 35 days. So again, we're going to see 25 to 50% faster healing than normal using the laser, okay? So wonderful for open wounds, phenomenal for burns. In my personal opinion, it's criminal that we don't have lasers in all burn wards. So I worked with Dr. Nelson down in Tucson, and the studies that we have are just phenomenal, and yet still 15 years later it's really not a standard of care, which is really a shame. So we need some more people out there touting the lasers, really helping to understand. So if you've had a really bad burn, even if it's an old burn, we'd like to catch you early, but even an old burn, we can change those burns. Not going to make it perfect, but we can break down a lot of that scar tissue, help the skin to heal naturally. Okay? So that's what we're going to do with wounds and with burns.